Good morning, everyone. We are here again to talk about weight loss clinic. For us, it's very important today to talk about two key points that people in my previous episode about weight loss clinic asking what is the best option for everyone. First of all, the answer for everyone is the same. You need to be evaluated. We need to pay a visit, and we can tell you what is the best option for you, because there are people they want to go straight to bariatric surgery, and there are people who want to go straight to Orbera gastric balloon. It's not working like that. We need to do a proper evaluation for the whole team, and later another type of episode, how is the way you can go to us, be evaluated in the perspective of generalized condition that you have as a patient to be a candidate to our program. First, the two points that we want to talk today is the first one is about the 5 big mistakes that people make to try to lose weight. And the second key point will be the difference between Orbera gastric balloon as a non-surgical procedure and bariatric surgery. Let's concentrate this first episode today to the 5 big mistakes. The first one is the diet. Sometimes certain patients ask me, what is the best diet for me? Exactly. The best diet need to be evaluated for 2 specialists, dietitian and nutritionist. Remember, in Google, in internet, we have plenty of information about different type of diet. What kind of diet you need to have is according to the frequency, the proportions, the amount, the quality of the food that you need to take is the dietitians and the nutritionist. They are the one really specialized in this kind of issues. Please, if you want to do a diet for your own, it's okay. But remember, we have our specialist here to give you a proper information and evaluate your general condition and tell you what is the best option for you. Second is to do for your own physical training without knowing your body, what is the strength and what is the weakness on your body to do a body training. That's why we all the time said you need to do training under proper supervision or instructions. Because, for example, people with overweight or obese grade 1 already have problem in the joints and the ligaments, like in the hips, in the knees and the ankle. When you do a certain exercise not well instructed, you can damage 2 or 3 of those conditions or 2 or 3 of those parts where you can injure yourself, then sometimes they are irreversible or you need surgery to try to get it back. And you will be already, you said, no, I will not do exercise again because this is harming me somehow. Another one is to choose plastic surgery as the first choices. All right, it's a choice for anyone, but remember, it's the last choice in our program. Why? Because when you start to lose weight, maybe the skin and certain fat tissue is hanging, is where you deserve that kind of surgery. Because certain patients, they say, no, let's remove my fat tissue from here and that's all. You can remove maybe 3, 5, 7 kgs. It's all right, but if you don't have a proper diet and you don't have the proper training, you gain that way back. And you lose your money first, and you start to gain again weight. Meaning, you did it for nothing. 4 big mistake that I'm seeing a lot of people in that condition is to taking diabetes medication without proper prescription and without proper orientation. Dapagliflozin and campagliflozin are Ozempic. Very careful with those medications. Those medications, the targeting point is the pancreas, is where the insulin need to be created, but also have a lot of side effects. For example, we had 2 patients, they use indiscriminated Ozempic because it's injectable, and one of the effects is to lose weight. Most of the current medication for diabetes people is to lose weight. But this one, specifically this one, people use like an injection. It's like insulin, but it's injection. And 2 of those patients that came to me said, what's going on with me? They use it indiscriminately. They make the injection more than 2 and 3 times in a day, and they are becoming starving because they really lost fully the appetite. becoming malnourished, becoming very dehydrated. They don't want to eat at all and produce pancreatitis. Okay. It's a threatened life condition that needs hospitalization and sometimes to go to intensive care unit. Please don't use it because the most important and serious side effect of Ozempic is the hypoglycemia, is the allergic reaction. They can produce gallstones because you are losing very fast the weight and you are starving. They can give you elevated heart rate, meaning tachycardia. They can give you the pancreatitis and they can give you kidney damage. Please don't use those medications as a choice to lose weight fast. You cannot lose weight fast because you can have those serious conditions as well. Please be advised for the doctor regarding to this kind of medication. Another one is to say to go straight to do bariatric surgery. That is a big mistake because you need to be evaluated first. Don't go, for example, I have several patients, they went to India, they went to UK, they went to Australia, to South Africa to do gastric bypass as a choice to lose weight. But they don't continue, for example, the diet or maybe certain type of exercise for this kind of condition that you need to do. Meaning that will be my first key point. In the next episode, we will talk our second point. Please be in contact with us. We'll give you better advice. Thank you so much.